Okay, fantastic. Let's dive into psychology. Just like quantum physics, psychology is a huge field, but in a different way. Instead of the incredibly small, psychology deals with the incredibly complex, the human mind and behavior. Where do we start? Well, let's think of psychology as a journey. It's a vast landscape, and we can explore different regions. Here's a sort of map to get us oriented. Think of psychology in broad categories. Psychology is often broken down into different branches or areas of study. Here are some of the major ones to get you started. Biological psychology, or neuropsychology. This area explores the link between our biology and our psychological experiences. It looks at the brain, nervous system, hormones, and genetics, and how they influence our thoughts, feelings, and behaviors. Think. How does the brain process emotions? What happens in the brain when we learn something new? How do genes influence personality? Cognitive psychology. This focuses on mental processes, how we think, perceive, remember, learn, and solve problems. It's all about the inner workings of the mind. Think. How do we pay attention? How does memory work? How do we make decisions? How do we use language? Developmental psychology. This area studies how people change and grow across their lifespan, from infancy to old age. It looks at physical, cognitive, and social development. Think. How do children learn language? How does personality develop over time? How do our relationships change as we age? Social psychology. This examines how people's thoughts, feelings, and behaviors are influenced by the presence of others, whether real, imagined, or implied. It's about how we interact with each other and the social world. Think. Why do we conform to groups? How do attitudes form and change? What causes prejudice? Why do people help each other? Personality psychology. This field explores the unique patterns of thinking, feeling, and behaving that make each person distinct. It tries to understand what makes us who we are and how our personalities develop and influence our lives. Think. What are the different types of personality traits? How stable is personality over time? What are the origins of personality? Abnormal psychology, or clinical psychology. This area focuses on understanding and treating psychological disorders and abnormal behavior patterns. It's about mental health and mental illness. Think. What are the symptoms of depression? What causes anxiety disorders? How can we treat schizophrenia? What is considered normal versus abnormal behavior? Evolutionary psychology. This relatively newer field applies evolutionary principles to understand human behavior. It looks at how our evolutionary history has shaped our psychological traits and tendencies. Think. Why are we attracted to certain types of partners? Why do we experience certain emotions? How did cooperation evolve? Positive psychology. This field focuses on human strengths and flourishing. Instead of just focusing on what goes wrong, like in abnormal psychology, it explores what makes life worth living and how to promote well-being, happiness, and fulfillment. Think. What are the keys to happiness? What are human strengths? How can we build resilience? Where to begin learning? To start learning psychology, I recommend a few approaches. 1. Pick an area that interests you most. From the categories above, which one sounds most intriguing? Starting with an area that naturally captures your attention will make learning more enjoyable. 2. Start with the basics. Even within your chosen area, begin with introductory concepts. You don't need to jump into complex theories right away. Look for beginner-friendly explanations. 3. Explore different resources. Introductory psychology textbooks. These are often used in college-level, Psych 101 courses and provide a broad overview of the field. You can often find used copies online or at libraries. Popular science books on psychology. There are many well-written books that explain psychological concepts in an accessible way for the general public. Think books by authors like Daniel Kahneman. You've brought up a really important and complex intersection: learning disabilities and drugs. This topic can be looked at in a few different ways, and it's important to be clear about which aspect we're discussing. Let's break down the relationship between learning disabilities and drugs into a few key areas. 1. Medications for conditions often associated with learning disabilities. ADHD medications. Learning disabilities frequently co-occur with attention deficit, hyperactivity disorder, ADHD. ADHD itself is not a learning disability, but it can significantly impact learning. Medications like stimulants, e.g., Ritalin, Adderall, and non-stimulants, e.g., Strattera, Intuniv, are often prescribed to help manage ADHD symptoms like inattention, hyperactivity, and impulsivity. By improving focus and attention, these medications can indirectly improve learning for individuals with ADHD who also have learning disabilities. Important note: these medications don't cure ADHD or learning disabilities. They help manage symptoms to make learning and daily life more manageable. They are most effective when part of a comprehensive treatment plan that may also include educational support, therapy, and behavioral strategies. Example: a child with dyslexia and ADHD might struggle to focus on reading tasks. ADHD medication might help them sustain attention long enough to engage with reading instruction more effectively, allowing them to utilize strategies for dyslexia. Medications for anxiety and depression. Individuals with learning disabilities are at a higher risk for experiencing anxiety and depression. The ongoing challenges and frustrations associated with learning difficulties can contribute to these mental health conditions. Medications like antidepressants or anti-anxiety medications might be prescribed to address these co-occurring mental health issues. Treating these conditions can indirectly improve a person's ability to learn and cope with their learning disability. 2. Substance abuse in individuals with learning disabilities. Increased risk. Unfortunately, research suggests that individuals with learning disabilities may be at a higher risk for substance abuse compared to the general population. There are several potential reasons for this. Frustration and low self-esteem. The constant struggle with learning, feeling different, and experiencing academic difficulties can lead to frustration, low self-esteem, and feelings of inadequacy. Substance use might be seen as a way to cope with these negative feelings or to self-medicate emotional pain. Social difficulties and peer pressure. Some individuals with learning disabilities may experience social isolation or difficulty fitting in, which can increase vulnerability to negative peer influence and substance use. Underlying mental health conditions. As mentioned earlier, anxiety and depression are more common in individuals with learning disabilities, and these conditions are also risk factors for substance abuse. Impulsivity. Associated with ADHD. If a learning disability co-occurs with ADHD, impulsivity can be a factor in experimenting with substances. Important note: it's crucial to remember that not everyone with a learning disability will develop a substance abuse problem. However, recognizing the increased risk is important for prevention and early intervention. 3. Drugs as a cause or contributing factor to learning disabilities. Prenatal drug exposure. Exposure to certain substances, like alcohol, illicit drugs, and some medications, in utero during pregnancy can significantly impact brain development and increase the risk of learning disabilities and other developmental problems in children. Fetal alcohol spectrum disorders, FASD, are a prime example of this. Substance abuse and cognitive impairment. Chronic substance abuse, especially of certain drugs and alcohol, can lead to long-term cognitive impairment and brain damage. This cognitive impairment might manifest as difficulties in areas like memory, attention, and executive functions, which can resemble or exacerbate learning disabilities. Medications with cognitive side effects. Some medications, while necessary for treating other conditions, can have cognitive side effects, e.g., drowsiness, confusion, memory problems, that could temporarily or, in some cases, longer term, affect learning and cognitive function. It's important to discuss any concerns about medication side effects with a doctor. 4. Smart drugs, or nootropics and learning disabilities. Limited evidence. There's a lot of interest in smart drugs, or nootropics that are claimed to enhance cognitive function and learning. However, for individuals with diagnosed learning disabilities, there is very limited scientific evidence that these substances are effective or safe for improving learning abilities. Potential risks. Some of these substances may have side effects, and the long-term effects are often not well understood. It's especially important for individuals with learning disabilities to be cautious about self-medicating with unproven substances. Focus on evidence-based interventions. For learning disabilities, the most effective approaches are evidence-based interventions like specialized educational support, tutoring, assistive technology, and therapy tailored to the specific learning needs of the individual. In summary, medications can be a helpful part of managing conditions like ADHD and mental health issues that often co-occur with learning disabilities, indirectly supporting learning. Individuals with learning disabilities may be at increased risk for substance abuse due to various factors. Prevention and early intervention are important. Prenatal drug exposure and chronic substance abuse can contribute to cognitive problems and learning difficulties. Smart drugs are generally not a proven or recommended approach for addressing learning disabilities. If you or someone you know is concerned about learning disabilities and drugs, it is crucial to seek professional help. This could include educational psychologists or specialists for assessment and diagnosis of learning disabilities and recommendations for educational support. Medical doctors, including psychiatrists, for diagnosis and management of ADHD, mental health conditions, and for advice on medication. Substance abuse counselors or therapists, for addressing substance abuse concerns. It's important to have a comprehensive and individualized approach when dealing with the complex issues surrounding learning disabilities and drugs. Is there a specific aspect of this topic you'd like to discuss further? For example, are you interested in learning more about ADHD medication, substance abuse risks, or something else related to this topic? Okay, schizophrenia is a significant and often misunderstood mental disorder. It's definitely related to our previous discussion because overlap with cognitive issues. Schizophrenia significantly impacts cognitive function, affecting areas like attention, memory, and executive functions. These cognitive deficits can sometimes be mistaken for or co-occur with learning disabilities. While schizophrenia isn't a learning disability itself, the cognitive challenges are a core feature. Medication is key. Like with ADHD and some mental health conditions related to learning disabilities, medication is a cornerstone of treatment for schizophrenia. Antipsychotic medications are crucial in managing the symptoms. Substance abuse risk. Unfortunately, individuals with schizophrenia also have a higher risk of substance abuse, similar to individuals with learning disabilities, though for somewhat different reasons. This makes the drugs aspect relevant too. Let's learn about schizophrenia. It's a complex brain disorder that affects a person's ability to think, feel, and behave clearly. It's characterized by a range of symptoms that fall into a few main categories. Core symptoms of schizophrenia. 1. Psychotic symptoms, positive symptoms. These are symptoms that are added to normal experience and are often what people think of when they hear schizophrenia. Delusions. False beliefs that are firmly held despite evidence to the contrary. These can be bizarre, e.g., believing aliens are controlling their thoughts, or non-bizarre, e.g., believing they are being followed. Common types include persecutory delusions, belief that one is being harmed, harassed, or plotted against. Grandiose delusions, belief that one has exceptional abilities, wealth, or fame. Referential delusions, belief that everyday events, objects, or people have a particular and unusual significance specifically for them. Thought insertion, withdrawal, broadcasting, belief that thoughts are being put into their head, removed from their head, or broadcast to others. Hallucinations, sensory experiences that occur in the absence of real external stimuli. They can involve any of the senses, but auditory hallucinations, hearing voices, are the most common in schizophrenia. These voices can be critical, commanding, or conversational. Visual, tactile, olfactory, smell, and gustatory, taste, hallucinations can also occur. Disorganized thinking, thought disorder, difficulties in organizing thoughts and speech. This can manifest as loose associations, derailment, jumping from one topic to another with little or no logical connection. Tangentiality, answering questions in a way that is indirectly related or completely unrelated. Incoherence, word salad, speech that is so disorganized that it's nearly impossible to understand. Disorganized behavior, behavior that is unusual, unpredictable, or inappropriate for the situation. This can range from childlike silliness to unpredictable agitation. It can also include problems with goal-directed behavior, making it hard to perform daily tasks. 2. Negative symptoms. These symptoms reflect a decrease or absence of normal functions. They often represent a loss of motivation and interest. Flat affect, reduced expression of emotions via facial expression or voice tone. The person may seem emotionally unresponsive. Alogia, Poverty of speech, reduced speech output. The person may speak very little, or their speech may be brief and lacking in content. Avolition, decrease in motivation and goal-directed behavior. Difficulty initiating and persisting in activities. May show little interest in work, hobbies, or social activities. Anhedonia, reduced ability to experience pleasure. Lack of interest or enjoyment in formerly pleasurable activities. Asociality, lack of interest in social interaction and social withdrawal. 3. Cognitive symptoms. These are subtle but pervasive and significantly impact daily functioning. They are often present even when psychotic symptoms are under control. Executive functioning deficits, problems with planning, organizing, making decisions, and problem solving. Attention deficits, difficulty focusing and sustaining attention. Easily distracted. Working memory deficits, problems holding information in mind and manipulating it. This impacts learning and following instructions. Processing speed deficits, slower speed of processing information. 4. Mood symptoms. While schizophrenia is not primarily a mood disorder, mood disturbances are common. Depression, feeling sad, hopeless, and losing interest in things. Anxiety, excessive worry and nervousness. Causes of schizophrenia. Schizophrenia is considered a complex disorder with no single cause. It's believed to result from a combination of factors. Genetics. Schizophrenia has a strong genetic component. It tends to run in families, but most people with schizophrenia do not have a parent with the disorder. Multiple genes are likely involved, each contributing a small amount to the risk. Brain chemistry. Imbalances in neurotransmitters, brain chemicals, particularly dopamine and glutamate, are thought to play a significant role. Antipsychotic medications primarily work by affecting these neurotransmitter systems. Brain structure and function. Research shows subtle differences in brain structure and function in people with schizophrenia compared to those without. This may include differences in brain volume, activity levels in certain regions, and connectivity between brain areas. Environmental factors. Environmental factors during pregnancy and early life may increase risk in genetically vulnerable individuals. These include prenatal complications, such as infections, malnutrition, or stress during pregnancy. Birth complications, such as oxygen deprivation. Early childhood trauma or adversity. Substance use, especially cannabis use during adolescence or early adulthood, in vulnerable individuals can sometimes trigger or worsen symptoms in those who are already predisposed. Treatment of schizophrenia. Schizophrenia is typically a chronic condition, but it is treatable. Treatment focuses on managing symptoms and improving quality of life. The most common and effective treatments include antipsychotic medications. These are the primary treatment for psychotic symptoms. They help reduce hallucinations, delusions, and disorganized thinking. There are first-generation and second-generation antipsychotics with different side effect profiles. Medication adherence is crucial for managing symptoms and preventing relapse. Psychosocial therapies. These therapies are essential alongside medication and help individuals cope with the challenges of schizophrenia, improve functioning, and develop coping skills. Examples include cognitive behavioral therapy for psychosis, CBTP, helps individuals understand and manage their psychotic symptoms, challenge unhelpful beliefs, and develop coping strategies. Social skills training helps improve social interaction skills and daily living skills. Family therapy provides support and education to families, improves communication, and reduces family stress. Supported employment and education helps individuals achieve their vocational and educational goals. Hospitalization may be necessary during acute episodes of psychosis when symptoms are severe, or if there is a risk to oneself or others. Assertive community treatment, ACT, a comprehensive, team-based approach for individuals with severe mental illness who need intensive support in the community. Important points to remember. Schizophrenia is not a split personality. This is a common misconception. Schizophrenia is a psychotic disorder, meaning it involves a break from reality. Dissociative identity disorder, formerly multiple personality disorder, is a separate condition. People with schizophrenia are not inherently violent. While there can be an increased risk of violence in some individuals, particularly during acute psychotic episodes or if substance abuse is involved, the vast majority of people with schizophrenia are not violent and are more likely to be victims of violence than perpetrators. Stigma is a major problem. People with schizophrenia face significant stigma, which can lead to discrimination, social isolation, and reluctance to seek treatment. It's crucial to approach this topic with empathy and understanding. Recovery is possible. While schizophrenia is often a chronic condition, with appropriate treatment and support, many individuals can experience significant improvement in their symptoms, functioning, and quality of life. Recovery is often seen as a process of living a fulfilling